If you're on Medicare, it is critical that you watch this video in its entirety as things are changing at a fast pace. Hi, I'm 𝗲𝗏 𝗏𝗏, been a Medicare insurance agent for a long time, been a licensed agent for 30 years. Can you believe that? 30 years. But today, we're going to cover what's going on with Medicare, because if you don't know it, it could really cost you for not only the next year on a Medicare plan, but also for the rest of your Medicare career. First, we're going to talk about the drug plan fallout, exactly as I predicted 3 months ago, and now it's in the news. Everyone's talking about it. Suddenly, how you can best navigate that and some critical things that you must know before you proceed. Also, ghost networks. What are they? Well, if you're relying on your insurance company or even Medicare.gov for the networks of your Medicare Advantage plan, you may be in for a very rude awakening. I'll share with you details on how you can avoid getting tricked into a plan that you're then locked in for the whole year. Freebies and Medicare Advantage plan. No, they did not go away as some anticipated, but what weight should you give those freebies when you're making up your mind on which Medicare Advantage plan? What is the most important thing? The truth behind the massive, amazing $2,000 max cap on the money that you can spend for drug plans for 2025, 2026, and beyond. You have to know this information and share it with anybody that you know that's on Medicare that's so excited that you only have to stop paying at $2,000 for drugs. Sounds like a good thing. And then I'm going to give you tips on where you can go for help and what the deadlines are so you don't miss any of them. First, man, Medicare Advantage has been coming on strong for years now. Medicare Advantage has actually led the enrollment. We're looking back all the way 2011 here, and you'll see that the numbers are growing and growing and growing, such to the point that now there are more than 34 million seniors that are on Medicare Advantage, relying solely on Medicare Advantage for all their healthcare needs. Is this a good thing, or is it just a trend? Well, a lot of people think that it's driven by the freebies, by the things that are offered to go along with your quote unquote major medical coverage. But boy, has it gotten big. Look at this all the way at the end. This is the breakdown, the current breakdown as of just a few months ago on what's going on with Medicare, and it is huge, the trend into Medicare Advantage. So where does that leave you? You better know how to shop for a plan. If you don't, it could really bite you. News story came out, and it's pretty shocking, actually. It talks about the Biden-Harris team raided Medicare to fund the Green New Deal. That's literally what happened in the Inflation Reduction Act. But I don't want you to rely on me, or certainly not politics, because this has nothing to do with politics. It impacts you directly. And yes, whoever occupies that White House does have a major impact on my constituents, which is the senior community, looking out for seniors so that they don't get bamboozled. And here's a story that came out that accurately called it, finally, like I did 3 months ago.
Guess is that going to be at the forefront of all three of these very big battles. He's the chairman of the tax writing House Ways and Means Committee, one of the most powerful people in Congress. He's also a man who brings common sense to the job today, Chairman Jason Smith. Sir, good to have you on.
It's great to be with you, John, as always.
Thank you, sir. We've been doing some reporting along with AMAC and others to highlight this little ruse that the Biden-Harris administration did a couple of years ago. They took some money from Medicare, spent it on green energy stuff. Now, all of a sudden, we discover it's going to result in a massive increase in Part D premiums for Medicare recipients. Joe Biden tried to hide it from the election, put some $5 billion of subsidies just to keep the increases past the election. I know you're on top of this case. How do we fix this, and how bad was the Biden cover-up?
We saw the Biden-Harris administration raid Medicare in the hundreds of billions of dollars in what they refer to as the Inflation Reduction Act. I call it the Inflation Expansion Act. And inflation's only gone up since they passed that legislation. But what they did, they put measures in place raiding Medicare, and now who's going to pay? Seniors are going to pay with higher premiums. But you know what? They tried to hide it before the election. They put through $5 billion, $5+ billion to insurance companies to prevent those premiums to go up before the election. The election's over with. Now the seniors are going to see the real damage that the Biden-Harris administration has done to their pocketbooks.
Yes, and the Congressional Budget Office, their report suggests that this cost-shifting policy will push Medicare costs directly onto taxpayers. So many critics argued that the recent Medicare cost reduction measures were really aimed at election year gains. but they undermine the Medicare's fiscal stability. So my question, sir, is how does the next administration regain the trust of seniors?
Not going to get into politics. Again, I'm just sharing with you what will absolutely impact you, and it's having that impact now. As a matter of fact, since I put that video out, almost 1 million views, people are finally catching on, and they're seeing the Part D impact. Please, again, and I'll give you some tips and where to go and resources at the end of this video and in the description of this video on YouTube, but please don't solely rely on the premium, the monthly cost of your Part D drug plan or even your Medicare Advantage plan. If you have one of those, you have to look a little bit deeper. I'm going to share with you what that is, but this, wanted to make it large so you don't miss it. If your drug, the drugs that you're taking, your specific list of drugs, if they're not on the formulary of your new Part D drug plan for next year, regardless of whatever year it is, then you are not getting credit toward your $2,000 new max out of pocket. What does that mean? It means that there have been a lot of changes on the Part D drug plan, not just the premium, which, as you'll recall, just talked about it, was subsidized at the last minute, so you did not notice the premium drastically changing this year. It was set to change massively, but that was arrested at the last minute with a demonstration program that the administration put in place with more than $5 billion out of the Medicare budget to go straight to the insurance companies so they would keep those premiums down. But the insurance companies are still on the hook for any and all costs above $2,000 that you may incur only for drugs that they list on their drug list known as the formulary. That's their list of covered drugs. So we're seeing drastic changes in the formulary. And we're always asked, can I just leave my old plan the way it was last year because the premium is just about the same with the new demonstration program that just came out? No, you can't. You have to put in your list of drugs, and now it's a do-it-yourself thing. It's very simple to do. Put in your list of drugs, look at the summary of the entire total cost, make sure that you pulled down on there, and I've got instructions on this over at our website, startpartd.com. Startpartd.com. I'll give you those resources again here in a minute. Just pay attention with me. Don't lose this. You have to pull down on the top right, sort by the total estimated cost for the entire year, and it will combine everything. And if you see the little red flag that your drug is not covered, or you see that your annual cost is $3,000, $5,000, $10,000 a year, you may be wondering, how can that possibly be? It's because if it's not on their list, which has changed, then it's not covered by them at all. And only things covered by them go toward the max out of pocket. And it's important to remember this. Only things covered by your Medicare Advantage plan go toward your Medicare Advantage plan out of pocket. Did you know that? Did you know that if there's a procedure that they say, no, you can't have it done, or it requires prior authorization and you can't get that done in the time that you need it done, and you otherwise tell the provider, get it to me right now, get me that pain relieving surgery, get me that chemo treatment started, but they did not authorize it yet? Not only do you have to pay for that 100% out of your pocket through the entire appeals process if you choose to appeal, which only 11% of people do, but that does not go toward your max out of pocket with that Medicare Advantage plan. A lot of people just simply don't know that. You have to play by their rules, and what they say is covered, then it's finally covered. You can expect formulary changes, even from the ones that you're looking at online right now. Regardless of the fact that it says today that that drug may be covered, it may not actually be covered. I have this resource, this document right here, which is the Part D manual for Medicare. It's in the description of the video, but suffice it to say, it may not be covered. And there's this really cute video. Oh, where is it? I have it here somewhere. Bless its heart. It's a video of a community organization talking specifically about formulary changes. And check this out. This is not being widely spread anywhere, so you need to share it.
Another thing to know is that not all drugs are on the same tier. And if you had certain drugs on tier 1 or tier 2 in the past, you need to check because they may very well have gone to a tier 3 or a tier 4. When I was doing some research with just some random drugs, I found that a lot of drugs had moved to the tier 3, costing you more out of pocket. Companies can change what tier a drug is on every 2 weeks, and they have to give you a 60-day notice so that you have the ability to let your provider know. But if a company either drops or changes the tier, you do not have the opportunity to change prescription drug plans. You have to stay with them.
Did you catch that? Even if they change your formulary mid-year, which they absolutely can do, that is the list of drugs that you signed up for. You made an agreement with them that you're going to be on their drug plan for the totality of the year. These are only calendar year contracts, both Medicare Advantage or Part D drug plans. We'll talk about supplements, Medigap plans here in just a minute. But those 1-year contracts, they can change the terms of those mid-year. Most agents don't tell you that. They can change the network of providers, and they can change the drugs that are covered. But what you can't do is rely on the fact that it got changed on you to then use that as a special enrollment period to jump ship and go to another plan. No, you can't do that. So you have to do your due diligence and find out if the network is right, if the drugs are right, if it's accurate. And we have these things called ghost networks, which is identified. I think this is a term first came up with this was Elizabeth Warren in the Senate looking into this. And ghost networks are not a joke. It's a bad situation where people are looking for a directory from the insurance company to see, is my doctor currently in this plan? And they'll think that the doctor's in the plan, but all of a sudden find out when they go to use the plan after it kicks in January of the next year, suddenly something has changed. So what can you do? You need to contact the provider's office specifically and ask them for next year, are you going to be in network? Next year, are you anticipating any changes to dealing with my Medicare Advantage company or my drug plan if you're going to a certain pharmacy? I would ask them, because the little known secret is, you may not know this, Medicare Advantage contracts with providers are not January to December like your contract with the insurance company is. It could be February, it could be June, it could be August when their provider contracts renew, and then a lot of them are dropping, as we've covered in previous videos, especially the hospitals. So I would call those providers and say, not only are you in the network now, are you going to be in the network for the foreseeable future as far as you know for next year? Don't rely on Medicare. Don't rely on our website. I'll give you that resource in a minute. But those things are subject to change. The only thing that's accurate is if you contact your provider directly and ask them, do you anticipate any changes? You have to do this step if you're going to get on a network plan, which is a Medicare Advantage plan. Now, with Medicare Supplement, don't worry about it. There is no network with Medicare Supplement. You can go to any doctor, any hospital, any facility across the country that accepts original Medicare, which is most everybody. That's right. So don't worry about it if you're on Medicare Supplement. You only need to worry about this when you're in a network plan, because those plans, like I said, they can change on you, but you can't change if they do. So you need to be aware of that. I'm going to show you an insurance company's commercial in a minute and show you the breakdown of where it gets it wrong. So if you bought a plan this year, or you're considering buying a Medicare plan this year, and by that I mean Medicare Advantage, off of the TV or some cold call or something you got in the mail, there's some tricks in those things that are word flips that you really need to know. And I'm going to break that down for you in just a minute. But ghost networks is just one of the things. And then all the giveaways. Boy, these companies are fawning all over themselves, trying to give away more money. I can give you this cash card, or I can give you a better dental plan. We had an agent tell me just the other day that a lady said she wanted a cash card. She wanted a debit card from the insurance company because a friend of hers told her that she can get like $100 cash debit card from an insurance company, Medicare Advantage. And the agent said, wait a minute, you're already on a cash back program where it pays back your Part B of $160, I think it was, $160 a month. She said, I don't care. I want the debit card. And he said, so you'll give up your $160 a month right back on your Social Security. You'll give that up for a debit card that's less? She said, yep, I want a debit card, regardless of the benefit of it. You need to find a good agent and you need to listen to them. I'm telling you, it could save you a lot of money. But as to getting a Medicare Advantage plan just for the freebies, I really want you to watch this. And also, when I break down that Medicare Advantage commercial here in just a minute, we're going to dissect that even further and see if what they're saying is true, and you need to be the judge there. But listen to this. This is from testimony in front of the U.S. Senate on this very topic of buying a plan based on the freebies.
Are trying to enroll in Medicare coverage for the first time. They meet with a broker or see an advertisement about Medicare Advantage plans offering $0 premiums and boundless supplemental benefits. Sounds good. Sometimes too good to be true. Are advertisements like this misleading? And if they are, what should federal government, what should we be doing about it?
They are, and this has gone on for years. We, on all of our public presentations and our counseling, we beg the consumers, do not choose your health.
By the way, this is a state insurance commissioner, and she's sharing here the frustration that she hears all the time of seniors negating everything important about their medical plan, their major medical, doctors, hospitals, drugs, forget all that. I want the freebies. And this is a real frustration that we deal with every day because people are not paying attention to the most important thing ever, which is their life and health.
Your prescription drug coverage based on an advertisement. The advertisements will focus on the zero premium, zero copay at a primary care, maybe no copay for generic medication. But we really want them to look at things like what is the copay for inpatient hospitalization per day? And when it comes to Medicare Advantage, also know that maximum out of pocket, which would be a limit to their financial risk. So the advertisements over the years have gotten more aggressive, and they do focus on those added benefits, specifically cash allowances, debit cards, money to go into the local drugstore and purchase items that aren't covered. And we have counseled numerous individuals, especially over the past open enrollment year. They were very upset with us because we could not use Medicare's Plan Finder tool to order the plans in order of the highest debit card to the lowest. And when we try to circle back to things like their specific providers, mental health needs, and other critically needed services, they really want to focus on those added benefits. And that has been a challenge for us due to the advertisements.
So is there, and I understand the federal government's recent steps to curb deceptive marketing help seniors sign up for Medicare coverage. Is that helping? Can you see some of that?
We are cautiously optimistic. We'll know more as plans go into effect in 2024. Personally, I've seen a bit of a difference in the commercials that are aired on television and the online ads, but there's still, and I get it, consumers with limited incomes, limited resources, to have those added dollars each month for groceries or utilities is a need. But if we can focus on the critical need, which is their health care and their medical needs, it could hopefully redivert them into plans that are best suited.
You ever heard the saying that the devil's best win was convincing people that he didn't exist? Similarly, but a little bit different, in Medicare Advantage, the biggest sales pitch that you'll be given, and remember, as agents, we make at least twice, if not 3 times the money if I were to sell you a Medicare Advantage plan. My office, the people that are back there, they help with Medicare Advantage. They help with low income plans. They also help with Medicare supplement, Medigap plans, and everything else in between, the dental, the vision, all the things. But it's important that you know that you start from a place of education and don't buy the line that Medicare Advantage is all the same exact thing as original Medicare, but extras. It's not the same, and I'll prove it to you here today. Stick with me. You've got to see this commercial and the breakdown. But just don't buy a plan based on just what the freebies are. The important things are is your doctor covered? Are all of your doctors covered? Call them specifically and ask them if they're anticipating being in their network next year. If you go outside the network and you get care that's not covered, you pay for it 100% out of your pocket, and it does not go toward your maximum out-of-pocket limitation. Can't stress that enough. Now, real quick, timelines and where to go. If you are one of the more than 2 million seniors in 2024 receiving the notice, and if you didn't receive it, you should check with your insurance company, make sure your plan's still there, because a lot of people just opted for the electronic communication, their annual notice of change, and that's not a good idea. But 2 million people impacted. You need to make another choice, but your choice period is not just December 7th. If you were terminated, you have an extra period of time. And we'll talk about another period here in just a minute. You can switch your Medicare Advantage plan to a different plan. So right now, you can either go back to original Medicare and pick up a Medicare supplement. If you go through underwriting, you can pick all the other plans, like a plan N. For instance, you have to go through underwriting for that. But you could, if you're losing your plan, you can get a guarantee issue Medicare supplement. It will be the most expensive. The insurance lobby has made it a point to make that a fact, that if you have to get a guarantee issue plan because you're being dropped somewhere else, then you're going to get a guarantee issue plan unless you talk to an agent who knows better and helps you try to get through underwriting, which then opens up all the plans. If what I'm saying right now confuses the daylights out of you, don't worry. I'm going to provide the resource where you can contact our office. We're reputable people and we'll help navigate that maze for you. But there's this other period. See, if you miss it, and we're taking more than 100 appointments a day in my office, which is amazing since it just started with me. Now we've got a huge team and growing all the time of like-minded individuals, fully trained and certified across these great United States to help people. There's another period of time if we can't get with you right now. That is January 1st to March 31st. If you're on a Medicare Advantage plan and you did not have the time during the period before December 7th to look at plans, to change plans, to make a full decision for the next year, you've also got this time frame, January 1 to March 31. They call it the open enrollment period. I still refer to it as the disenrollment period, which is what it was originally designed for. So from January 1 to March 31. Now, people are going to ask, wait a minute, December 7th ends the annual election period. But what happens between December 7th and January 1st? I'll tell you, the insurance agents get to know their families again. It's a beautiful thing. They get to go home, maybe go on a little vacation, take some time off as the insurance companies are processing everything for January 1. But then again, January 1 starts this period where you can change your Medicare Advantage plan. You can look at the market. You can talk to your providers. You can take more time if you're already on one to decide which one you want to go with for the remainder of 2025. And it's important to note, any change that you make during this period will take effect on the first of the next month. Even if you waited until the last day of the month, the law says any changes made with Medicare Advantage take effect the first of the next month, unless you're in the annual election period, which is before December 7th. Those just take effect January. You can drop your Medicare Advantage plan. It is critical that you get the timing right on dropping a Medicare Advantage plan. I would never advise you to drop a Medicare Advantage plan and just go back to original Medicare. As good as it is, original Medicare only pays 80% of your Part B costs. You are responsible for the 20%. And that's not to say anything about the $1,600 plus you're going to pay if you go into the hospital under Part A and all the other costs. Medicare was never originally designed to be 100% comprehensive care. There are holes in original Medicare, as good as it is. And again, remember, with original Medicare, not Medicare Advantage, you can go to any provider across the country, any hospital, any doctor, any facility, without a referral and without prior authorization and without wondering if someone's going to approve your procedure that you need done. Oftentimes to save you a lot of pain. You don't have to get somebody's permission like you do in Medicare Advantage. All you need to do is make sure that they take original Medicare, which most providers do. So you can drop your Advantage plan and go back to original Medicare during this period too, the disenrollment period. However, you need to have a soft landing, and it's critical that you find out, and you can go to our website, which is seniorssavingsnetwork.org, click the Medicare Help button, and there's a part there that says you want to go from Medicare Advantage to Medicare Supplement, and it breaks down the steps that you have to do in order. If one of those steps involves going through underwriting to get on a Medigap plan, Medicare Supplement plan, we need some time to get that done. So the sooner you let us know, the better. And we'll be honest about your chances of getting through underwriting. Most people are shocked that they can get through underwriting, and most do. You can change or start your Medicare Supplement plan. And that's what our office started doing way back in the day, getting expertise in underwriting. How does that work? because the only time you can get a Medicare supplement, a Medigap plan, without any underwriting is when you're first new to Medicare and you've started Part B for the first time. You get a 6-month open enrollment window. Now, curious enough, all these millions of people being dropped from their Medicare Advantage gives them a different period, but it's not open enrollment. The technical term is guaranteed issue. And what's the difference? On guarantee issue, the insurance company gets to pick which plan you're eligible for, not you. See, when you're in open enrollment, you're brand new to Medicare, you can pick all the letters of the rainbow, colors of the rainbow, letters of the alphabet. You can pick them all. With guarantee issue, if you're being dumped from a plan, dropped from an employer plan, lost your employment and all that, then you could get a guarantee issue plan. But the little known secret is, if you know underwriting, you can wiggle into those better plans, like a Plan N. It's all explained on our website, and it takes you through the whole process if you want to see it. But you can change your Medicare supplement plan any time of the year. As a matter of fact, the worst time to change from one supplement to another is during the critical limited time frame of the annual election period from October 15th to December 7th. We're so crowded during that time, especially now with millions of seniors losing their Medicare Advantage and wondering what they're going to do, that we've literally dedicated all those resources to try to get as many of those people on our packed finite calendar as we can to help them, because otherwise they'll have essentially no coverage whatsoever. So, but you can change your Medicare supplement any time of the year. Just the fact that it's renewing, going into another year, because those benefits never change, they can just change prices, does not mean you have to shop and change your plan right then. Even if it's December or January, you can do that any time of the year. There's no special period there. So 2025 changes. If you want to see your Medicare Advantage plan, and if it's changing for next year, or if it's not changing for next year, is it staying the same? You can go to this website, seniorssavingsnetwork.org/update. Now that's the different one. That's under changes. If you go under seniorssavingsnetwork.org/changes, you can see your plan, and you can see if it's migrating to another plan or completely being dropped. This is going to be the numbers for Part B for 2025. And every year, if you're watching this in future years, you can go to this website and see what the latest costs are on Medicare and the income-related Medicare adjustment amount, the IRMAA, for those people who are high income earners. You can look at that and see what those rates are. And it's going up to $185 a month just to be on Medicare. And people in Medicare Advantage are saying, why do I have to pay for a Part B premium every month to be on a Medicare Advantage plan when I don't even get to participate in original Medicare's Part B? Because that money is being funneled right to the private insurance company, the Medicare Advantage. But to either have Medicare Advantage or Medicare Supplement or be on original Medicare whatsoever, you have to pay this, and it's paid out of your Social Security, or if you're not drawing Social Security, you have to mail it in or sign up for direct deposit. That's the best thing, direct withdrawal. And the Part B deductible, which will affect some people on original Medicare or a Medicare supplement that participates with the Part B deductible, that's Plan G Medigap plan or Plan N, that cost is going to $257 a year. That means you hit that deductible by paying the first portion of your doctor bill or your outpatient bill of any kind. You'll pay the first portion of that bill after Medicare has repriced it, made it much smaller than they originally billed. That final amount, the negotiated discount that Medicare has, you will pay those costs on Plan G and Plan N until you've satisfied $257 for the year. It's important to remind you, if you're on a Medicare supplement plan, G or N, or any letter that has a deductible part of it, this is the deductible. It's set by the government. So we already know for 2025, the deductible is now $257 for the year. And after you've satisfied that, they keep track of it with Medicare. After you've paid your doctor costs of $257, then everything kicks in with your supplement. On Plan G, all your costs are paid for the rest of the year, but your premium's much higher and your rate increases are higher. On Plan N, that's when your copays start. The copays to go to the doctor on Plan N start after you've satisfied the deductible yourself with your doctor. And then those copays are from $0 to $20, depending on what the doctor charges. It's a percentage of the bill, but it's no more than $20 to go to the doctor on Plan N. Need more information on that? It's on our website. If you've not yet subscribed to the updates on this channel, more than 157,000 have, but still more than 90% of the people watching our content are not subscribers, I highly encourage you to subscribe because of updates that you're going to get that could be critically important to you if you're on Medicare or approaching Medicare. Just to remind you, because some agents just absolutely won't say that there's a difference, there are two sides that you have on Medicare. You can either do original Medicare, which is what you bought and paid for your entire life, and you earn that right to do so. You can do original Medicare because you paid for it. And that means any doctor, and this is straight out of the Medicare and You guidebook, by the way. If you don't believe me, go to medicare.gov and you can see that. Original Medicare is your first and best choice. If you can afford to be on original Medicare with a Medigap plan, that is the gold standard. Less and less people are able to do that in recent years because of inflation and everything costing more. I get that. And don't assume for a minute that I think that everybody should always be on a Medicare supplement plan. Is it the best? Yes. But some people do have a champagne taste. They want to go absolutely everywhere, but they have a beer budget and they can't get on a Medicare supplement plan. That's why you have to have an agent that can do both. An independent broker is your best bet, and it doesn't cost you anything to let someone guide you through, here's the best choice, here's what your budget is, and here's one in the middle that gets the best of both worlds. The best thing we can get to accommodate both your budget and your freedom and flexibility. So that's what our office does. Other than original Medicare, your choice is Medicare Advantage, where you're limited to a service network. You're limited to them deciding if you're going to get approved for things. You're going to have to fight for yourself. You may have to do some appeals, and you may have to fight people for referrals and prior authorization. That's just the name of the game. That's just how it works. But it's important that you know we can actually help with both. On a Medicare, original Medicare, you'd want to couple that with a Medigap or Medicare supplement plan. So it pays those extra costs, like the 20% that's not covered. And incidentally, if you're getting those Part B costs, there is no limit to the out-of-pocket. You could pay that 20% ad infinitum. Is that the correct Latin? There is no limit on that. That's why most people want to pick up a Medigap plan or Medicare supplement. So not only do you have the freedom and flexibility to go anywhere, but when you do, you don't have to take all of your savings that you've saved up to pay those costs. On Medicare Advantage, typically people will want to get cancer insurance to go with that because one of the biggest gaping holes in Medicare Advantage is cancer. You're going to be subject to 20% of your treatment cost, and that's only the approved treatment costs for cancer. The unapproved ones, you pay 100% of those costs because they're not approved and they don't go toward your max out of pocket. So cancer insurance, if you're on Medicare Advantage, is critically important to get. And if you can't get through to my office or another office or your broker because of this crazy time of year, then as soon as December 7th is over, I highly encourage you to get on the phone and find out how inexpensive and what a great value having cancer insurance is so it can pay for all of those costs for you. Also, hospital indemnity plan is important if you have a big hospital copay cost on your plan. We have those plans as well. You have to supplement the things that you get, even Medicare Advantage. So here's where you can see the changes. You can go to this website, seniorsavingsnetwork.org/changes, and you can look up your plan based on your region, and you can see, are there any changes for my plan next year? Is it going away? Is it being migrated to another plan without your knowledge or without your consent? They call that crosswalking, and it's happening a lot. A lot of plans are being crosswalked into another plan. It's critically important that you know what that is. Maybe you threw away something that you thought was just junk mail, and it was your annual notice of change where it would have explained that to you. Now you can use this resource and find out what those changes are going to be for your plan. Pretty important, right? Medicare supplements, if you have a Plan G, a Plan N, or a Plan F, Plan K, Plan L, Plan M, for those that buy it. Medicare supplements are not going to change now or ever, forevermore. They don't change. You don't have to come back every year and say, my plan's renewing, what's different for next year? Because your benefits on a Medicare supplement will follow you across the country, just like a life insurance policy would be doing. You buy it one state, it's still good in another state. Supplements are the same way, and they'd never change. The benefits, the percentages, the cost, and all that stuff, the copays, they're not going to change on Medicare supplements, so you don't have to worry about it. But again, if you want to shop your rates, because the only thing that can change on those plans is the rate. They typically go up, and we can shop those rates for you. The best time to do that is after December 7th. Here are some resources for you, and I'm going to show you that amazing ad breakdown for Medicare Advantage and where I think they got it wrong, and not just my voice, but a whole bunch of experts here in about 10 seconds. But if you need to look at a Part D drug plan for the next year, please go to startpartd.com. You can look up your drugs. You can sort it by the total estimated annual out-of-pocket cost. That's the way to do it, and pick the lowest one for the next year. If you want to look at Medicare Advantage plans, you don't want to talk to anybody, go to MedicareAdvantageNearMe.com, and you can do that, and you can actually enroll there as well. And our main website, SeniorSavingsNetwork.org, where you can book an appointment with a licensed professional that only has your best interest in mind. You can book that appointment 24 hours a day. Here's a very important public safety announcement. Public service announcement. Don't miss your appointment. If you book an appointment with my office, don't miss it, because you may not get another one. Please also don't get our information just to look at it and then go to a local agent. That's not even ethical. If we brought you to the dance, please dance with us when we get you there. Our important information is a long time in certifying and training for and getting ready for this year. So please, with the limited spaces on the calendar, don't lose your spot. If you signed up for an appointment, please keep the appointment. Look for the confirmation email where you could possibly change it if something comes up, but don't miss your appointment. Not only is it rude, and I know things happen, I know, but you may not get another shot at getting an appointment with our office. Let me share with you the breakdown of the ad. Don't get offended. This is not just one insurance company that I'm calling out here. It's just the latest ad that I saw. It's actually called an advertorial, where they put something on the local news and they make it look like the news actually cared and gave them free airtime, but they didn't. And what they actually did is they bought the airtime to pitch their wares. In this case, Medicare Advantage. Every year I go over these things and pick ones at random. This year it just happens to be one of the companies that we actually sell here. We actually do business with them. They're very nice people. They brought us, I think it was donuts or bagels here recently. This is not about them. This is the industry as a whole. And these are the little things that they say that you may or may not find to be slightly inaccurate or foggy. But I've got the proof here. Let me show you.
Health insurance that meets our health and budget needs is important, especially as we age. For our viewers who have Medicare or have loved ones that are eligible, right now is an important decision time. During the annual enrollment period through December the 7th, individuals eligible for Medicare can choose a Medicare Advantage or prescription drug plan for 2025. Jeremy Gaskell, Humana Regional Medicare President, is here today to tell us more about Medicare Advantage. Good to see you, Jeremy. Thank you so much for joining us. And for those who aren't familiar with Medicare Advantage, can you share a bit more about it?
Thank you for having me. Medicare Advantage is a health insurance plan. It covers your medical bills, like your hospital bills, your facility bills. It covers your provider costs, such as going to see your primary care physician or your specialist, just like original Medicare. Just like original Medicare.
That's really interesting.
If a senior has original or traditional Medicare, they can expect to receive up to 100 days of coverage for their stay with no hassle. If a senior has a Medicare Advantage plan, however, they can expect to receive a denial well before their doctors even say they're ready to go home. This is despite the requirement that's been discussed that Advantage plans must offer the same benefits and apply the same coverage criteria as original Medicare. When a patient first receives a denial, they're thrown into a maze of red tape that is dizzying even to our experienced legal team. The initial denial is made not by the Advantage plan, but a third-party contractor using an algorithm. A computer determines what a patient's predicted length of stay should be based on millions of past beneficiary data points, not the patient's plan of care or the advice of their doctors. Then, at each additional level of appeal, if the patient actually chooses to fight it, the denials are upheld by quality improvement organizations with little to no explanation. If a patient is successful with an appeal while still in the facility, they can expect a new round of denials to start in a matter of days. Patients caught in this maze are forced to make a devastating decision: stay in the rehab facility and pay thousands of dollars out of pocket, or go home against medical advice. In Wisconsin, we have a unique legal services program with attorneys able to take these cases at no cost. When we represent clients at federal hearings, more often than not, the denials are overturned. But this is after months of document gathering, preparation of summary briefs, rounding up witnesses, and a telephone hearing against a team of representatives brought by the Advantage plans if they show up at all. Even if a patient is successful at hearing, it can still take well over a year to get reimbursed. This issue has even hit me personally. This past holiday season, a family member called me and explained that his 89-year-old mother had fallen and was hospitalized and entered a skilled nursing facility for rehab. They'd received a denial after just a week, and they didn't know what to do because her doctor said she still wasn't ready to go home. My first question was, does she have an Advantage plan? When the answer was yes, my heart sank because I knew immediately what this family was going to be up against. After a total of 3 falls, 2 hospital stays, and repeated denials, she ultimately went home against medical advice and decided that the appeals process was too stressful to pursue. Fortunately, this family had enough money to pay for the denied charges and lived close enough to help locate safe housing options and home care. But what does this situation look like for an individual with no family or friends or legal representation? In Wisconsin, the average cost of just 1 day in a skilled nursing facility is over $300. The individuals who can't afford to stay will likely be advised to spend down their assets, forcing poverty to qualify for the state's Medicaid program. Now, these are not uninsured individuals. These are individuals who have chosen and paid for a Medicare product that was heavily marketed and aggressively sold to them. They're not getting the coverage that they paid for, and they're met with hurdles at every turn. Nor are these patients abusing the system. No one truly wants to be in a skilled nursing facility. Patients are actively trying to get home. In the case examples that I've provided your investigative team, you'll note that in nearly all situations, the patients returned home on the timeline prescribed by their doctors, and sometimes even earlier, not the unrealistic and at times unconscionable timeline forced upon them by their Medicare Advantage plan. Our most valuable citizens are up against an impossible system, and I want to thank you for your time to investigate these practices.
Joining us now on the 4 o'clock show from the capital city is Insurance Commissioner Mike Cheney. Commissioner, I understand the Insurance Department has received some complaints from insured patients, if you will. What have been kind of the nature of some of those complaints?
Most of the complaints that we receive concern people being switched from regular Medicare Part B, D, or F to Medicare Advantage plans, which a lot of companies are pushing because there's more money for them in it than it is for the patient. And the complaints are that the doctors are not in the network. The doctor they've been seeing for 20 years suddenly taken out, that they're not approved to go to the hospital to have needed surgery. I had one this morning from a major media company that said, call the commissioner, he can help you, where the company just decided they didn't want her to have surgery at her age on the shoulder. So the complaints we have are about switching from regular Medicare and not telling the consumer what's going on. Be very careful about changing over to a Medicare Advantage plan. Once you get on an Advantage plan, if you try to go back to a regular Medicare plan and you're sick or you really need help, they can rate you. In other words, your rates will double, sometimes triple, based upon your health condition. That's something you can't do in regular insurance, and you can't do it on regular Medicare. So be very careful if you buy an Advantage plan.
But there are additional benefits above and beyond original Medicare. For example, most plans have prescription drug coverage. Most plans have dental, vision, and hearing coverage. And all plans have a maximum out of pocket, so everyone knows what is the most they could spend in a given year going in.
That's really interesting.
It's a kind of bait and switch plan. They bait people to come in with the promise of providing more, but in fact, many of the beneficiaries receive less, correct? Said it works until you need the big stuff. Maybe you can explain what that means.
Yeah, absolutely. To the point of the supplemental benefits, enticing people into taking them, that's the short term. And we all have, short-term goals. It's easy to save money at the beginning and to say, I'm going to get these extra things that original Medicare doesn't cover. That's really, enticing for me to take this plan. There might be a low premium as well. But most of us don't think about the larger problems when they're actually going to need help. And like in Ms. Ben's case, they looked and they saw 100 days of coverage. That's what they expected to need when the time came. And absolutely, I would say it's a bait and switch because you get to that point when you do actually need those bigger things and you're denied.
So it looks like a good plan as long as all you need is like dental or vision. Everybody needs dental poor vision. Nobody plans on melanoma, correct?
Correct, yes.
Or on other kinds of acute rehabilitative or long-term rehabilitative care.
Yes, that's correct.
I know it's changing all the time, but are there any big changes happening this year?
There are changes every year with Medicare. That's why it's really important as a member is evaluating what is the right plan for them going into next year, that they look at their current plan and they look at any changes that might have happened year over year.
Changes happening this year?
There are changes every year with Medicare.
Medicare supplement don't change their benefits. Ever. Ever. They don't change their benefits. The old Plan F is still there. Heck, if you bought a Plan J back when it was really a good deal in 1995, it's still there, same benefits. If you bought a Plan C, a Plan D, a Plan G, a Plan N, Plan L, and you still paid the premiums, those things are really cool. It's called guaranteed renewable. No matter what happens to your health, no matter where you move in the country, they can't take it away from you. Isn't that cool? No matter how many times you go to the doctor, how many times you go to the hospital, how many times you get cancer. The benefits never change, and there is no network. There's just not one.
With Medicare Advantage, members are limited to the carrier's network of providers if they want to avoid any of those out-of-network charges, right?
That is correct, but we have a broad network of hospitals, facilities, and providers. It depends on what plan you're looking at and what network you're looking at. That's why it's, again, really important as the members are evaluating what is the right plan for them, that they confirm that their preferred providers and preferred facilities and hospitals are in the network of the plan they're considering. And that's easy to do. For Humana, you just go to humana.com and you can confirm it right there.
That's really interesting.
Now, unlike traditional Medicare, the private insurance companies in Medicare Advantage can establish networks to restrict the doctors or facilities that beneficiaries can use. So if your doctor is in network, the plan will cover those services for a small copay, but an out-of-network doctor can leave patients with skyrocketing costs. This can be especially devastating for seniors or for people with disabilities who are more likely to be living on fixed incomes. To help beneficiaries avoid these surprise costs, MA plans are required to publish directories which enrollees can use to find new doctors or to make sure their existing doctors are covered. So let's start with what we know about the accuracy of these directories. There have been some references to them, but Ms. 𝗫𝗿𝗄𝗄, did I say it right, Ms. 𝗫𝗫𝗄𝗄? What do we know about the accuracy of the provider directories in Medicare Advantage?
So CMS has done some audits, Senator, and what they found was on average, the accuracy rate was about 45%. So,
what does that mean that the accuracy rate is 45%?
You know, they found in 2018, I think it was, almost 50% had at least one inaccuracy. So, we're seeing a good deal of inaccuracies. That's with physical health care. Just say there's a gap in data because they haven't done this for behavioral health yet.
And might we surmise that behavioral health accuracy?
It's always worse.
It's always worse. It's always worse. Okay. So you think you've got a list of people you can go to, and the odds are actually in favor of the list is wrong, and probably even worse on behavioral health. All right. So here we've got a patient who does everything right. They still may be hit with a huge bill because a directory has outdated or inaccurate information. We know that MA plans use all kinds of tricks and traps to squeeze more money out of Medicare. They've got a lot of different ways that they do this to boost their numbers. But here's the one I want to focus on. Do these MA plans stand to gain anything from having inaccurate information? In other words, is it inaccurate because they just haven't spent enough money to make it accurate, or is it inaccurate by design?
Well, I think there are advantages that they have when their directories, unfortunately, are inaccurate. If they use those directories for network adequacy standards, for example, they might meet the standards, but they're not accurate. People make choices based on what they see as their network. So if it looks like a bigger network, but it's not real, people are choosing a plan.
Okay, so it's a way to defraud consumers. To to say, I have this really big list of people you could go to if you had a problem. And it turns out that really big list, if it were accurate, is actually this little tiny list, right? Okay.
Right. And then,
so that's one way. It's to the advantage of the Medicare Advantage plan in order to be inaccurate. They get paid, in effect, or they make more money by being inaccurate. Did you have another one?
well, just that, I think it's about 60% of the plans don't have out-of-network coverage. So if you get really frustrated and you pay on your own, then they're not paying anything.
So the more I can frustrate you, the more that meaning the Medicare Advantage plan, the more the Medicare Advantage plan can frustrate you, the more you'll just go somewhere else. And that means it's not money out of their pockets. Did we get the two main ones you wanted to add?
I just was going to add, Senator, this is, yes, we see this all the time. This is health plans delaying and denying care. That same patient, once they finally find the needle in the haystack and even get to a physician who's in network and sit down and get a diagnosis and a treatment plan, then goes to the pharmacy and discovers the health plan requires prior auth for the treatment for that condition, which then it takes weeks to get approved. Sometimes they never go back to the pharmacy. They give up. Their mental health or their other chronic condition gets worse.
So conditions get worse and they don't have to pay for the treatment. This Medicare Advantage plan.
Many seniors are either retired or eagerly anticipating retirement so they can travel more. For Medicare beneficiaries planning to travel out of state, is their health care covered with Medicare Advantage?
That's a great question, because sometimes it is a misconception that you cannot travel with a Medicare Advantage policy, and that's just simply not the case. For example, I would suggest the PPO network and the PPO plans tied to the PPO network are built for travelers. It is a nationwide network, coast to coast, of hospitals, facilities, providers, and specialists, and are structured in a way, for example, if you sought care or saw a provider in Florida, it's going to cost you exactly the same as it would if you sought care or saw a provider in your hometown.
That's really interesting.
The insurance company is cutting ties with St. Luke's, terminating its Medicare coverage plan. And a lot of viewers wonder if they now have to change doctors. Reporter Eric Fink joins us live to explain how this change could affect you in tonight's big story.
Roland St. Luke says the hospital and Humana couldn't come to terms on an agreement under the company's Medicare plan, thus leading to some very different health options for some of our oldest and most at-risk members of our community.
I'm kind of in shock of what's going on, but I don't want to change.
Medicare patient 𝗏𝗏 takes a handful of medications daily for a brain tumor, congestive heart failure, and diabetes. Thursday, he got a letter in the mail saying his Medicare coverage plan under Humana would no longer be accepted by doctors at St. Luke's. According to the letter, Carl's coverage would expire January 1st, 2014, with no explanation of how to get other insurance.
I'm not sure if that's part of the Obama program. I don't have a clue because I don't have any paperwork. Nothing is there. Humana hasn't called, said anything to me.
And Humana never called us back when we asked for an interview. That said, Carl, this change did not come about because of Obamacare.
Humana wanted to renegotiate a contract at a lower reimbursement rate that we financially couldn't accept. If you do have a plan that St. Luke's doesn't accept, you're free to look at other plans that are accepted by St. Luke's and make that switch, and then you'd be able to keep your St. Luke's doctor.
Carl wants desperately to stay with his St. Luke's doctor, who he's gone to for almost 20 years. But after researching other Medicare plans, staying with St. Luke's could force this Nampa man to pay a much higher deductible.
What am I going to do next? We're talking more than $2,000 and stuff, and that's a really hardship when you're on a set income.
And there is an open enrollment period for Medicare plans covered through St. Luke.
You be the judge. Is it true that it's the same exact benefits as Medicare, original Medicare? Same thing. No restrictions whatsoever. Is it the same thing that is it true that the extra benefits make it worth giving up original Medicare and going on Medicare Advantage? And is the network never a problem? As long as you go to a company's website and it says today that that provider's in there, is a network never a problem with Medicare Advantage? And again, let me just reiterate, I know that not everybody can get a Medicare Advantage plan. Not everyone can afford it. I do know that. We hear it all the time. That's why we can be all things to all people here. That's why we can give you honest, real input as to what your budget might allow for and try to put you in the plan that best fits your needs, because everybody is unique. Everybody is special, and everybody deserves their own time with a trained, licensed professional. And by the way, not only is that licensing a lot of work, it's also a background check by the FBI, submitting our fingerprints and doing a background check on a continual basis to make sure that we're not ripping people off. That's a very important thing. And you can check the licenses online all the time to make sure you're dealing with somebody legitimate. But we're here to help you. And I'm just here to tell you the truth. And sometimes it's not really pretty, but the truth is unique. And sometimes you shouldn't have to go so hard to find it. But I'm glad that you found this YouTube channel. I'm very thankful for the years and years of dedication and commitment from our clients working with us, helping us through the growing pains over the years, helping us navigate this new Part D world that we're in, adopting and getting to be experts in Medicare Advantage, and then taking on carriers across the country so we can help people if they're in South Dakota, or if they're in Florida, or if they're in California. And now that we have representatives for each of those locations, simply at the end of a phone call, if you tried to call us, by the way, important to say this, since we're getting thousands of calls per day, the best way to reach us is up there at the website, because there you can easily book your own appointment that we will not miss. We will not miss the appointment. I encourage you not to miss the appointment too, but skip the phone call. And I know our generation and the generation of my mom is that you make a phone call, and if they can't get on the phone because everybody's on the phone already, you leave a voicemail and they'll call you back. The challenge is we have 2,000 people that we're trying to call back, and then we miss you, and then you miss us, and you don't know who's calling and the caller ID, and it's a problem. So the best thing to do is make an appointment yourself at the website, which is really easy to do. And then when the phone rings at that time, simply answer it, regardless of what it says on the screen. I don't know if the screen's going to say our name or our number or what. We're here to help you. We're here to give you the truth. Don't miss the appointments if you're making one. And that's all I got to say. I'll be watching all the things in Medicare. I've got about 20 more news stories that are developing right now that we're watching. I'll continue to bring them. If you need updates, you need to know what's going on with Medicare as far as the costs go, that's at seniorsavingsnetwork.org/update. God bless you. Thank you so much for watching, and we'll see you.